Hey guys, welcome back to my channel. Welcome. My name is Tasheena. Thank you so much for clicking on this video, and for all my new subscribers, I'm seeing the numbers going up. I definitely appreciate it. Continue to have your friends and your family member come on over to subscribe so I can grow on this platform. All right, thank you for watching the video once again. Now, without going around the world, in today's video I will be talking about something a little bit different. So it's incompetent cervix and also cervix cerclage. Now when you hear cervix cerclage, of course cervix has to talk about with the female down there, right? So for persons who don't know, you can do your additional research, but for the informational purpose for the video, cervix cerclage is basically a stitch that you have to be given at some point in time of your pregnancy when it is found that your inner cervix starts opening up, which is a little abnormal. Now it's associated with what is called incompetent cervix, and what this means is that the cervix wall is just not strong enough to remain, the inner wall of the cervix isn't strong enough to remain closed whilst still pregnant. Now of course you can imagine, if the cervix inner wall is being opened before time, then this means loss of pregnancy can take place. Yes. So what happens to correct this type of situation is called a cervix cerclage, which is a stitch of the inner wall of the cervix to actually keep it closed until it's full term for your pregnancy, as well as whenever the baby decides to come, because sometimes the babies will come before the full term, which is the 40 weeks or 37 or over 37 weeks. They can come before that. All right, so I want to talk about my experience with the said cervix cerclage. So my situation was like this. I went to the health center, the clinic, and I was doing the regular checkup. It was in my second trimester, because now I'm in my third trimester. So in my second trimester, that was back in February, I went, did the checkup at the clinic, and I would have gotten the form because I wanted to know the gender of my baby. I got it February 13th, went to the clinic February 13th. The same day I went and I did the ultrasound, because I like to be proactive. So I went and I got that done at the lab, which was somewhere in Maypen. So I got it done. I got the sonogram photos of the baby and thing of that sort, confirmed the gender and thing of that sort. No, they didn't explain to me that come tomorrow for the report or anything like that. But I remember the day after I was on the phone with my spouse, and this would have been the 14th, now February 14th. I was on the phone with my spouse, and I kept on saw this number calling over 5 to 10 times, and I was like, hold on. So I answered, and I realized it was the lab, and they were like, you need to come and get your results so you take it to the hospital, because the doctor needs for you to get the results. I'm like, doctor? It was a nurse from the health center that gave me the requisition form. So what doctor are you talking about? But anyways, what they wanted, basically is to let me know how urgent the matter was. So the long and the short of what happened was that the baby was healthy. So when I was there doing the ultrasound, everything was good. The baby is healthy and everything. However, what they noticed on the report is that my inner cervix wall had started opening. At that point, I was like I was about 20 weeks. So my inner cervix wall started opening prematurely, which should not be the case. And of course, since this is the immediate opening that separates the baby from coming through the birth canal, misconception can take place, or miscarriage rather can take place. So of course this is dangerous, and would have been needed to be dealt with in a timely manner. So I realized from their conversation that you need to come and pick up the report. I picked up a level of urgency, and I'm like, all right, So I got my brother to go and pick it up, and I got the report. I was scrutinizing it, but at the time I had called the health center midwife already. So I was speaking to her, and she said, as soon as you get the report, send it to me and I'll tell you what is what and all of that. Anyways, so when I got it now, everything started moving in such fast pace, I tell you, fast pace. So I got the report, I was scrutinizing it. I sent it to her first. I started scrutinizing myself. I realized everything, gestational age, all the details that would be on it. But I remember seeing it says like recommendation, emergent obstetrician consultation. But before that, it had stated that the cervix had started opening. So by this, she had already engaged in explanation, because she called me and she was explaining what is happening. Your inner cervix starts opening, and in a case like that, we need to do an emergency surgery. I was like, say what? So you can just imagine moving from the baby is healthy, and this still does not mean that anything was wrong with the baby, by the way. It was just my cervix. So moving from a place hearing the baby is okay, and then today everything going rapid, you're gonna have to do emergency surgery, that type of a thing. Listen, this is my first pregnancy, first time pregnant, and I have never had to be admitted in the hospital. Never had to be admitted in the hospital for any reason. The only time I visit an hospital would have been to look for somebody. So this was like the first of many first time being, well, I wasn't fully like admitted per se, but first time to be admitted in the hospital, first time to do surgery, first pregnancy. Didn't know what to expect, because like I mentioned, everything started happening in such fast pace. I didn't know anything about cervix cerclage or incompetent cervix. I didn't know anything about that at all. So the nurse was explaining to me, and she's like, because she lives in my scheme as well, so she's like, you're gonna have to go to the hospital. But first she said she consulting with a head doctor at the hospital. So she consulted, and it was recommended that I go immediately and get the emergency surgery. Delay would be danger, basically. So as a precaution, get it done out of the way. Of course, hospital bag never properly packed or anything like that. Or listen, because I'm like, pretty early, not expecting this at all. So that type of a thing. Anyways, we got in motion. My mom was here, my little brother. We got in motion. We started putting stuff together. And quick. You might hear the truck outside. Don't pay that any mind. So very quickly, we got in motion and we started getting stuff together. Eventually the nurse came, because she had needed to give me a form that I needed to take to the hospital to basically state that it was recommended for me to do the procedure and all of that. Although she would have called the head doctor already, and he would have informed his team there, and they were expecting me. That type of a thing was just necessary to be done. So I remember I was there. I even think that evening I cooked, and I had it already. I remember when I started looking at the letter again, and after the nurse explained, because as I say, everything moving fast now. I don't know anything about this procedure, never been in this situation before, first everything, and it's a bit overwhelming. I started breakdown, and I'm like, I don't want anything to go wrong with my baby. My mother and my little brother said my face, I was looking so distraught. But you can imagine, nobody wants that type of a feeling. Anyways, so after that, don't know, packed and everything, got ready. The nurse came, she gave the requisition form. She said everything will be okay. I shouldn't be on my foot too much. And I should just, no bending and stuff, let them do things for me as much. Anyways, fast forward now, reach the hospital, and this is it. This is not to bash our healthcare system here in Jamaica, but we have work to do with regards to it. All right, with that disclaimer out. So when I arrived at the hospital, went by the emergency area, whatever. All right, we were there. Because remember, I had to get this requisition form or this form to say, it's already known that I am supposed to do this procedure, which is a cervix cerclage procedure I'm referring to. And can you believe we were there waiting for a while? We waited for a while. I think they call it the triage nurse. He did the vitals and whatever, and I was like, I got this letter to do, because he was asking why I'm there, and I said whatever. And then we sat and waited again because there was another room. I think it's the admitting nurse did the vitals, and then we were working for the triage doctor, but we were there waiting. And one of the time I said to my mom, say something, because sometimes when you sit and you wait, nothing happens. Anyway, she tried to get the attention of one of the other nurses that was at the front desk. She said, wait until the triage came. Waited. And then I said, no, man. And by this, I think we reached from like after to 8 or 8 o'clock, right? I think we reached at the hospital. Anyways, I was in the wheelchair sitting down. I wasn't feeling any pain or anything like that. But I remember one time I just said to my brother, wheel me over to the front desk. And I go into the lady, the same nurse that my mom was trying to get the attention. I said to her, I don't understand. Why is it that I'm waiting when I have this form that says I need to do this procedure? And I opened it out and I was showing her. And she's like, okay, come, go around and get registered. So all this time, we sat in that area waiting. And then we had needed to go get registered. Imagine. After that, no, we eventually went around to the other area where I was asked some questions. They started screening me basically for my procedure. I was asked some questions, and then I was put in I don't remember the position it's called, but basically what that position is like my head would be lower and my upper body not so high. My foot would be a little bit elevated, and that was to take the pressure of the baby off the cervix in the case he was pushing too much on the cervix wall. And that would have been preparation for my surgery. In that position, my mom and my little brother was still there. We're talking, a doctor came, she did her, they're gonna go through their disclaimer form. Hold on, this truck is passing. Now, while in that position, I was answering questions from 2 different persons at 2 different times. The last one was a doctor. I'm not sure if the first gentleman was a doctor. I'm assuming he was. All right, so the last person, the female doctor, she went through all the disclaimer forms, gave all the necessary information and the risk associated. Now, the risk associated with a cervix cerclage is that the membrane, which is that sac that the baby is in, it can be ruptured. Anything can happen. The cervix cerclage itself, which is the stitch, can end up not holding up. These are all things. It's a foreign matter going in the body, so you might have some discharge, stuff like that. You can do your research of the various risks associated with the procedure, but relatively it's safe. So she went through all of that, and I remember she said to me, so you want to go ahead and do the procedure? I was like, okay, because what else is there for me to do? I would really not prefer to have to do any procedure, but it's needed. So I think I waited a bit more. And I remember her asking me at one point, saying to me at one point, we were waiting so long. And I was like, yes, we were around there waiting a long time. So saying this to say that in terms of the wait time that can be eliminated in our health system, we can really work on that. Because it can just make a minute or 2 of a difference. In my case, it wasn't anything very drastic, but the essence of what I'm saying is that sometimes we can be a little bit more careful, and careful is the word I'll use. Anyways, so that happened now. I started prepping for the surgery, had to remove my clothes and all of that. And of course, during this same way, I'm not comfortable. First time hospital experience, it was not comfortable, but it wasn't the most uncomfortable. It's not like I was being mistreated, you get me? Not that type of vibe. But anyways, they wheeled me around to the theater room now, because prior to that, I want my mom and my brother to stay, regardless of whether they might keep overnight. So they couldn't determine. But the procedure in itself can take as less as 30 minutes, if not less time than that. That's how simple it is, right? So I wanted them to wait. So we're discussing whether or not, they should wait. I told them to wait regardless, to see whether or not it's going to be quickly done or whatever. They'll keep me overnight or anything. Anyways, they wheeled me around to the theater. We're there, did another disclaimer, answering questions with the anesthesia doctor. And eventually they wheeled me in the theater room. Now this is where it got real. So I was a bit relaxed because the theater doctor, she was the anesthesia doctor. It was two of them, one Nigerian and a Jamaican girl. They were pretty cool. And them have the thing, and it was a little bit intimidating over my nose, and as I say, I'm not used to this type of thing. So it was a bit intimidating, and then how thick the flap of the ends were, you just feel intimidating. So I was relaxing, to be honest, and I don't know, when the doctor came in the room, the energy just shifted. You ever know or feel a shift in an energy in a room? That was how it was. And that was because of her demeanor that she came with. So I'm not knocking anyone, but I'm just saying it's very important as healthcare workers and people who have to provide service to people, especially in a sick situation or, health-wise. Let's be careful of the energy that you come with. It can be challenging to balance, your tiredness and all of that. It can be challenging. Not talking from a place of perfection, but be careful, because what energy you come with can set somebody off in a panic, and let them be, all of that. And remember, customer service is needed in every area. All right, this was what happened. So the doctor came in, and from she came in, I felt the energy different. Because as I said, I was relaxing and, inhaling and relaxing, because they had to put the blood pressure, they string me up, basically, like I was string like this. So something was on that finger here, and then the blood pressure thing wrapped around my hand. I was okay. When that lady walked in, I was like, and she came in with her energy, like, she's like, all right, let's get this over with. That was the level of energy. So I feel like possibly, because we're human, possibly she was tired, but the energy really threw me off. So she was like, let's get this over with. And she walked in with the lady, the doctor that I had met, that was in the disclaimer earlier, which she was very friendly and whatever, because I told her I wanted her to come in the room. So she came in and she was like playing with my finger and said, you see, I come in, and I said, yes. So she made me a little bit more comfortable. But the doctor that actually operated, that I found out she was the one who operated, she came in with the energy and she was like, let's get this over with. And I was like, wow. No little, oh, my name is Dr. So-and-so, I'll be the one operating on you. Don't worry, no little, no little vibe like that. So, of course, by this, I am so much like watching her closely. And she went out, and they went, I don't know what these things are called, that the foot would be, they put it on the bed. There are some parts on the bed that they can screw it, and your foot would be placed on it, I guess, in a case where they're going to do anything down there, so your legs are apart. So she went out, because there was a Nigerian doctor too. So she went out, and I think she went with him, and they came and they were screwing. So it's like, as I mentioned, the anesthesia doctors had already strapped me up, but because of how long the table was, they needed to adjust me. So she was like, come down. So I said, ma'am, wait, I am strapped here. So, all right, that was, second thing. No, of course, I'm still watching her, because as I say, the energy just, So after that, no, I came down and they strapped me back, because it was closer to the edge, because you know I needed to be as close down for her to do her thing. It didn't start there. So after that, no, I started panic because of how she was behaving. I started like not feeling comfortable, evidently. So when they were putting the thing over my nose, I was telling the anesthesia doctor, you know, give me a little release. They were being patient, by the way. And they were like, okay, take a minute and think, because the thing had to be strapped to, it just kind of felt a little cluster type of vibe. Anyways, she was like, I don't have time for this. I don't have time for this. This was how the doctor was acting, you know. I don't have time for this. I was like, why are you behaving like that? This is my first experience. I don't have time for this. I don't have time. So I said, all you need to do is be understanding with me. You know, that I am basically talking, because of course, remember anesthesia at that time. So, you know, that type of experience, it wasn't that pleasant for me. It wasn't very unpleasant, but at the same time, it could have been better with just her soft skills. You get what I'm saying? Because the energy she came with just threw me off completely. And then, oh, she kept on acting, you know, make me question, say, if you are going to really operate for me, you know, that type of vibe. Not that I'm questioning her competence in her job, but it's just her attitude. Anyways, long and the short of it, the anesthesia doctors, they were calming me down, and I take about 2 per 4, so, and I'm out. Because I was under anesthesia when it was done. So I was out. And then what I recall was they were calling my name and they were calling it wrong, because instead of Tasheena, they were saying Tasheena. And at first, you know, the lighting was blurry and all of that. And I remember distinctly hearing her voice. So they were trying to debate as to whether to have me stay on in the ward or whatever. But nothing was wrong with me, as I said. It was just that the cervix had started opening. So really and truly, I never needed to be admitted there. Although I made to understand that they should have observed, but nothing was wrong. So she never recommended that I had to stay in the hospital. Kudos to me, because me never want to stay in no hospital. Me not telling no lie. That was like God working right there. So me never want to stay in no hospital. Me never want to stay overnight in no hospital. Yeah, me never want that. So I never had to do that. Eventually, my consciousness became a little bit more clear. My vision was cleared and whatever. And you know, the Nigerian doctor was like testing my pressure and all of that vitals. And my first question is, I touched my tummy and I was like, baby, okay? And he said, okay. And all of that. So how I felt after the procedure, it did numb, it did tender, and just overall, you're going to be a little bit more, a lot more cautious and a lot more sensitive down there. So that happened. I think I stopped being extremely sensitive to the stitch and all of that probably 2 weeks after or so. Not that I didn't have it in my mind, you know, but not as sensitive as before. There was a lot of thoughts that went through my head. So if you have to go through something like this, you know, I hope this would be informational for you to know what to expect. And it's natural, you're gonna question yourself, you know, is it that I did something now with this incompetent cervix, which is why I had to do the cervix cerclage. It's nothing of your doing. It's just the body's, I'd say in a sense, malfunction, the cervix malfunction, where it just opens when it's not supposed to as yet. But there are precautionary measures you can take to ensure this doesn't happen to you. However, you don't know whether or not it's going to happen until you become pregnant. So I guess beforehand, you want to ensure you're not lifting anything. You're not bending too much. You're not doing too much of anything during your pregnant state. Because I did think, yeah, all right, pregnancy, I go and good now, I'm on sickness, and then bam, this come. So it's nothing of your doing. It's just a malfunction of the body, and it happens. Many women have to go through this type of a thing. So don't feel bashed, or anyway, it doesn't mean you're infertile, because of course you're still pregnant. It's just that you need additional assistance to maintain that pregnancy, because if it's not stitched, then you're going to lose that baby. Chances are you're going to lose that baby. And of course, after this, you have to do bed rest. I wasn't on complete bed rest, but of course, you lay a lot. You do a whole lot less strenuous stuff. No one bag of cooking, no one bag of cleaning in the house. No jump up on nothing. You're not you know, that type of a vibe. You take it very slow. Now this was an adjustment, and I won't even say it's gonna be an adjustment for everyone because it depends on what your normal routine is. But for me, pretty independent and like to do things on my own, and you know, it was an adjustment because this now means that you are a bit more dependent on your family member or your spouse to get stuff done for you. So what you can do is give yourself grace. Don't beat up yourself. But I can understand if you go on this emotional psychological path, not very deep, but you know, you're just wondering and you want your baby to be okay. Because I was always thinking about, you know, because like I said before it started happening, I didn't know anything about this. And that's one of the things, you know, that can probably make you feel a little bit more conscious, not knowing, and then it's happening. So the best you can do is educate yourself as you go along, so you know what to expect, what you can do to help your situation or not. So let me see. I gave you guys a whole lot of info about my experience. So that was pretty much it. And oh, for the very first night, well, it was the early morning that I came back home after the surgery, because like I mentioned, it wasn't a very long surgery. So then, you know, whatever you pass through, you're gonna see blood. It's okay for you to see it in that first day or a few hours after the surgery, as you know, the excess will be needing to pass. But if it persists, then you'd need to get a follow-up. For me, I was given a prescription. I had pain medicines. I have what is called endometrine, which is an vaginal insert. It's a white pill, which is progesterone that maintains the environment for the pregnancy to continue. There was also, let me see, I'm trying to remember. I think it was 3 things. Yeah, one was an antibiotic thing, which is just 2 capsules that you had to take, and you take that immediately, right? And then the endometrine, which you take 1 a day. And the thing with the cervix cerclage procedure is that once it's done, based on my understanding, you're gonna have to continue to use the endometrine inserts throughout your pregnancy, because it continues the environment, it fosters the pregnancy environment in your cervix, because it's the progesterone hormone. So you're gonna have to do that. So, you know, at times the doctors will give you a refill if you need, if you so desire. It is pricey. So for persons who are in Jamaica, it is quite pricey. It can range from anywhere between 8,700 Jamaican dollars to 9,500 or so, depending on where you go. So you can shop around for that. I didn't finish all of my pain meds because I wasn't really in any pain. I wasn't feeling any abdominal pain or anything like that. So I didn't live on them. Let me see. So after doing that, the cervix cerclage, it was just resting time, to just rest. And you know, at this point you're going to need to find a whole lot of things to do to occupy your time while you are resting, because you can easily become bored. Either you read, you watch movies, series, whatever the case is. So there you have it. That's my journey with cervix cerclage, or cervix cerclage is the procedure, but the issue at hand is the incompetent cervix. And the incompetent cervix is just when your inner cervix wall begins to open before time. Hence why you need to do the cervix cerclage, which is the stitch to correct that. All right, there you have it. I hope this was very informative for you. So do stay tuned for different aspect of my journey, because since I had the cervix cerclage, of course, at some point, I think it's between the 36 to the 37 weeks, they're gonna have to have this removed. So I'll definitely be sharing that experience with you and any other updates throughout this journey. Pretty new to me, and I'm excited to share. All right, thank you so much for watching. I do hope the information shared was informative for you. Any questions or comments or encouragement, feel free to leave them down in the description in the comment section below. All right, bye.